Hello everyone, welcome to my channel. My name is Paula and I had open heart triple bypass surgery on April 28th, 2025. And I created this channel to share my journey. And if it helps even just one person out there, then that makes me very happy. My cat is now in the background. Today I will discuss my open heart triple bypass with you. So April 28th, I barely had 3 to 4 hours of sleep. And I woke up at 5:30 in the morning so that I could be at the hospital for my check-in at 7:30 in the morning. I tried to stay as calm and as zen as possible, and I think I did a pretty good job. My hospital was pretty strict, and I have a feeling that they kept many of the COVID protocols that they set, which I appreciated because it showed how much they cared about patient care. For example, I was only allowed one person in the pre-surgery room, though they could switch out if they wanted. After surgery, only 2 people were allowed to visit me in the ICU, and only for 15 minutes before they had to leave. So that morning, I brushed my teeth, put on my clothes. It was a brisk spring day. I said goodbye to cilantro. After that, my husband and I picked up my mom and my brother, and we made our way to the hospital. I walked to the cardiology wing of the hospital. With my family, checked in at the front desk, and I had some paperwork to fill out. This included providing them with a living will if I had one, which I didn't. They asked if I wanted them to notify my primary care physician that I was there, and I was also able to provide my husband's phone information along with my mom's so that they could receive updates. We walked downstairs to the main waiting room, and I told them what I was there for. And then I was told to sit for a few minutes because they weren't ready yet. I looked back at my mom and she was starting to break down. She thought that that was the last moment that I was going to see her before my surgery. I looked at my mom and said, "Mom, don't cry. You're gonna make me cry too." And I told her that I'll be okay. But I said that with a lump in the back of my throat. I was trying not to cry too. I had tears in my eyes, but I didn't let it fall out. After my diagnosis, I tried to stay strong for my family because the last thing that I wanted was for them to worry about me. But honestly, it was unavoidable. I think a lot of times they were worried about me more than I was about myself. Oh my gosh. 10 minutes passed and my name was finally called. I gave my brother and my mom a big hug, and my husband and I were ushered to the surgical prep area. We were in the pre-surgical room before 8 o'clock in the morning. There are a few things that need to be done before your surgery, and I'm not sure if it's the same for everyone. But for me, it started with removing all of my clothes and putting on a hospital gown, a regular hospital gown. My weight was taken and I weighed in at 140 pounds. And just for reference, I am a 5'2". I laid back down while my vitals were taken. At this point, my nurse was basically checking me in, so there were the typical questions that were asked, such as what medications I was currently taking. That also includes any vitamins and supplements. They asked if I had any allergies, and they confirmed my contact person. As part of my vitals, my blood pressure was taken, and anytime I'm at the hospital or a medical setting, even at the clinic where my physician is taking my blood pressure, it always skyrockets, and I just get very anxious and very nervous. So when they took my blood pressure, it registered at, I think it was around 160 over 100 or 170 over 100. Nurses and staff are usually shocked by this, but I just have to explain that this is a typical reading for me whenever I'm at the hospital, and I just have to explain that I have white coat syndrome. But as an aside, looking back at it now, my skyrocketing blood pressure was a sign that something was wrong. Anyways, after my vitals were taken, I was asked to go to the bathroom and wipe myself from the neck down with 2% chlorhexidine gluconate wipes. It's a type of cloth that's used before surgery. They're basically antiseptic or antibacterial wipes that are used as part of surgery preparation to reduce the chances of infection before surgery. Once I was back on my bed, an IV line was started. And fun fact about me, I have very tiny veins. I am what is known as a hard stick. It runs in my family on my dad's side. Most of us have really tiny veins, and we either need the smallest needle or staff who's really good at sticking needles. But anyways, once my IV was started, the original nurse who was with me before was asking more questions so that she could complete her chart. While that was happening, another nurse came in and she said something like the surgery is finished or it was canceled. I honestly don't remember which one of the two are correct, but my surgery got bumped up. And the three of us, my nurse, myself, and my husband, we were all like, what? What's going on? So the nurse said to me, your surgery will be earlier than anticipated. And I asked, okay, how long do we have? And she basically said, you're up next. We only had a few minutes. I was like, oh my gosh, okay. And I was just speechless because I was anticipating maybe another 2-hour wait, because that's what happened when I had my catheter angiogram done. That one was delayed for a little bit. The next 30 minutes flew by. We spoke with the anesthesiologist very briefly. I changed from my hospital gown to a surgical gown. I placed the surgical cap on. And the next thing I knew, I kissed my husband goodbye and I was being wheeled off to the surgical room. The surgical nurse who was with me asked what happened because I was so young, and I gave her a brief explanation as to what happened, that my husband and I were getting ready to start a family, and since I had high blood pressure and high cholesterol for years, we just wanted to make sure that everything was fine. And through various tests that were done, it was found that I had 3 severely blocked arteries. She was very sweet and said some very comforting words. When I entered the surgery room, I was asked to shout my name, my date of birth, and the reason I was there, so what type of surgery I was having. And then I was transferred from the hospital bed to the surgical bed. To me, it looked very narrow and it was relatively high, I would say. At this point, my heart was probably pounding really fast. And I still couldn't believe that this was actually happening. Another nurse came by and asked how I was doing, and the other nurse told her the reason I was there. They both said, you have nothing to worry about. You're in good hands and we'll take really good care of you. When they said that, I just nodded, but I could feel that lump behind my throat forming, and all I could say to myself was, don't cry, don't cry, don't cry. The anesthesiologist then hovered over me and he started a line for my anesthesia. He gave me something to calm me down first, and he was observing my reaction. I remember I didn't really feel anything at that time. I felt like nothing was working. But once he said, I'm going to administer some more, I started praying and everything went black. The next thing I knew, I was waking up in a dark room where I could see a nurse sitting on a chair and I could see a clock and I could feel the breathing tube down my throat. But let's get back to the surgery. So what did they do exactly? I underwent what's called an on-pump open heart surgery. This is more of a traditional type of open heart surgery. A heart-lung machine temporarily takes over your heart and lungs during surgery. It keeps your blood flowing and full of oxygen while a surgeon works on your heart, which is stopped and free of blood to make the surgery safer and more precise. My body's temperature was also cooled down to a lower temperature to slow things down and help protect my brain and other organs while my heart is stopped and the heart-lung machine keeps me going. Since I had 3 severely blocked arteries, I required 3 grafts for my surgery. For younger patients like me, surgeons prefer to use arteries rather than veins because they're seen as more durable and more resistant to clogging, and they give the best long-term results. And so my left radial artery and BIMA, which is the bilateral internal mammary arteries, were harvested for my grafts. The BIMA involved harvesting arteries from behind my chest wall or underneath my breastbone, where my sternum was essentially split open so that 1, they could harvest the arteries that they needed, and 2, work on the surgery itself. The surgery was over in about 3 hours. I mentioned before that my surgeon was the head of cardiothoracic surgery at my hospital. I consider myself very fortunate that a surgeon of his expertise and reputation took on my case. He called my husband and spoke to him briefly in person, and he said that the surgery was successful. They shook hands, and then my husband and my mom both visited me in the ICU while I was asleep. By the time I woke up, it was around 3 o'clock. And I remember this because I was in a room where my bed was facing the outside. I don't know how to describe it. Like, the ICU rooms that they had at that hospital weren't exactly rooms. It was more a little open, but they had partitions. With me, I was so lucky that I was able to see a clock right outside my room, because anytime I was conscious, I always looked at the clock. I wanted to know what time it was. I kept drifting in and out of sleep, and the nurses were trying to tell me something. I couldn't understand what it was. And like I said, I had the tube down my throat. Eventually, I understood that one of the nurses were telling me that I needed to stay awake, because if I couldn't stay awake, then they couldn't remove my tube. I tried really hard, but as the anesthesia was wearing off, it was just very difficult to stay awake. I also remember, I think they were either moving me from one bed to another, or they had to remove something from my back. They asked me to roll on my side, and it was just so scary. Mind you, you're just out of surgery. You know that your chest was opened and it was placed back together. So doing that motion, it's just a little jarring. And I recall it was a little painful. I remember gasping once I was finally on my back again. Around 6 p.m., I think I was stable enough. And I remember a few nurses coming in, and they were reminding me what to do while they removed my tube. And it's a good thing that I watched a video before surgery, because one of the videos I watched, they said, don't be alarmed if you wake up with the tube down your throat. Don't panic, just breathe normally. And that's what I did before they removed the tube. So I remember they were saying, okay, we're gonna go in now and we're gonna do a suction with the tube. So I did the suction. It felt weird. It felt like it felt like tickling. And then they warned me, they said, okay, when we tell you to start coughing, you have to cough. So they counted down, okay, 3, 2, 1. They were like, okay, start coughing, start coughing. And when I started coughing, that's when they started taking out the breathing tube. And that was the first feeling of relief that I felt during my hospital stay. But immediately I felt the pain in my throat. Oh my gosh, I could not speak. And anytime I spoke, it just kind of, I remember it sounding like, it sounded like that. My lungs weren't that great either, because I just came out of surgery. I just had a really bad sore throat for a little bit. My night ICU nurse, she was such a freaking rock star. I remember her working in all cylinders, making sure that everything was good with me, taking my blood work, giving me ice chips, and just being such a sweetheart, and at the same time, just such an amazing ICU nurse. And I also remember my husband and my mom calling one after another. My ICU nurse told them that everything was fine with me, that I was awake, but that I couldn't speak because they had just removed my endotracheal tube. That night felt like it was one of the longest nights of my life. I do remember being in pain, and anytime I was given some medication, it offered a little bit of relief, but not too much. Like, you could still feel the pain. I don't really know how to describe it. It was just like your body's in pain and the medication masks it a little bit, but not enough for you to be completely fine. At least that's how it was for me. I was given a few different types of medications, and I think they do circulate between different types of pain medication just to avoid any issues. I remember I didn't really like oxycodone. It didn't really work for me much. But a few hours later, I was given Dilaudid, and it worked immediately. I freaking loved it. I thought to myself, why didn't the oxy work as good as the Dilaudid? I'm still not sure why, but that was my experience with it. Like I said, I was given ice chips. I remember my ICU nurse checking on my fluids, and I also remember being given a blood transfusion. So the night went on. I knew what time it was, and I was very grateful that I knew what time it was. I would rest for a little bit, and then I would open my eyes and look at the time. I was still very heavily groggy because I was still waking up from the anesthesia, plus I was on pain medication. Like I said, my ICU nurse was a freaking rock star. I knew she had 2 patients because she was working on me and the other person next door, which was an older gentleman. We all had similar birthdays in November around the same time, and we were all Scorpios, so I thought that was interesting. And then the next day, when there was the change of hands, my day nurse was also a November baby. She was also a Scorpio, so that was pretty cool, I thought. I said goodbye to my night shift ICU nurse and I thanked her profusely. And then my day shift ICU nurse came in and she took over. By 7 o'clock in the morning, they knew that there was a room available for me. So they started prepping me. I had a central line on my jugular vein, so they removed that. They also removed the catheter. And before they removed it, I asked if it was gonna hurt. And she said, for women, most of the time it doesn't, just feels like a little bit of a sting, but it's very quick. So when they removed it, I was surprised that it didn't hurt because I was always scared of a catheter removal. It was at the top of my list of things to never experience. And here I was experiencing it. Before I was moved to the step-down unit, I was asked if I wanted some food. I asked for what type of food they had, and I think it was a choice between applesauce or bone broth, so I opted for the bone broth. It felt really good for my throat because my throat was still very sore at this point. So then after that, I was able to be moved from the ICU to the telemetry floor. I had a very nice view of the mountains. It was a very sunny room and I was very happy. I had to walk from the wheelchair to the recliner in the room and I felt like I was still dizzy. And I was dizzy. So they exchanged hands between the nurses. My vitals were checked and I was given my first round of medication. I was asked if I wanted some painkillers and I did say yes to that. So I was given oxycodone. And this is where I'll end my story for now. In the next video, I will go over what happened day by day at the hospital. So thank you for watching. Don't forget to like and subscribe. Leave comments down below and I'll see you next week. Thank you. Bye.